Welcome to this video for ERS around medical gases. So as per the PowerPoint you've already watched, this is going to be the practical element of using medical gases. So the first thing for me is to make sure that you know the equipment you're using on the day. Always do an equipment check before you start your kind of time of duty, if you like. So there's standard oxygen cylinders which we get from BOC, but you may also have other types of cylinders which we need to be aware of as well. The design of our training bag and the bag we use on our vehicles is when we arrive at the scene, we open up the front packet and we've got our SpO2, our pulse oximeter, which we can place onto our patient to see whether they need oxygen or not. When we open up their bag, because we've always left our zips in the middle, we can open it up slightly. We can now get to the blue pouch without opening up the whole bag. So this could be next to the patient. We could get out the desired oxygen mask that we require. So on this occasion, we've got a non-rebreathable mask here. And then I could attach it to my oxygen, which is easy to get to. So rather than opening up the whole bag, I can easily get to it, have my oxygen attached and go through that. On other occasions, you will want to fully open the bag, so we're going to drop it down, and that means we can get to our oxygen. So again, a different configuration of oxygen, just make sure you know your cylinder. Let's just have a look at this cylinder as a standard one. The gauge on the front tells us how much oxygen is in there. Knowing the size of the oxygen and knowing the gauge, we can work out how long it will last. Also, if you go onto the BOC website, there's an app you can download on your own personal phone, and if you scan the barcode and then you scan the gauge and then you put in there which oxygen you're using, i.e. 2 litres, 15 litres, it will tell you on that app how long it's going to last. So for our patients who require lots of oxygen, or they're on that red list that we talked about from the Thoracic Society or the JR Calc, we are going to give them 100% non-rebreather. So on this cylinder here, I'm going to turn the oxygen off, making sure that my flow meter is off there. So on the side here, we just turn it on. Only needs to be cracked to turn. We've got the oxygen there, and I can just purge it quickly just by turning it. Make sure I've got oxygen coming out, which it is. I'm then going to just push fit that on, making sure there's no grease or oil, because grease and oil support combustion with the oxygen. So we keep all of this nice and clean. I can now turn this up, and on this I'm going to turn it all the way up to 15 litres. I don't want to put my hands anywhere near the inside of this because my patient is going to be wearing it. But I could ask the patient if they would like to put a finger or a thumb over the valve, which will help fill the mask, and then keeping the elastic back, ask the patient if they want to place it over their mouth and nose, and then the elastic can go around the head. Remembering in the previous video about collars, if they've got a collar on, there's little hooks on the collars we can use. As they're breathing, you'll see the bag going in and out, and that's a really good way to count their respiratory rate. If the bag is overfilling, you can turn this down maybe to about 10 litres. Don't really want it much lower than that. So this would be used for our red list, that high trauma. Lots of times we're going to use it for that. The other masks we're going to use may be a simple face mask. So we can use this. I'm just going to swap the tubing over. This one doesn't have a bag. Normally we would give this to patients who only need a little bit of oxygen, so maybe their saturations are between 86 and 94, so we're going to give them a little bit of oxygen just to top that up. Or the last one is we could have a nasal cannula. When using the nasal cannula, again the oxygen flow rate will be less, make sure you present it. If the patient can put it on themselves, they do so. But basically, these little prongs just going to sit up their nostrils. Then the earpieces will just go around and they can go in front. So it's always in front of the patient. We never do it behind, and again, that would be attached. Don't forget, oxygen is a POM, a prescription-only medication. You must fill in the paperwork for it. And on here, on the paperwork, it's quite small, but there are places to put that you've put your medical gases on there. So make sure we use that. So we've got the oxygen bit here, and make sure that is filled in every time. And again, just as a reminder, the top copy comes back to us at ERS. The bottom copy, the carbonated one, the pink one, that can go off to the hospital or medical provider you're passing care on to. Don't forget to put your cardboard in between. Excellent. I'll see you on the Entonox video.